good morning, good afternoon, depending on which time zone you are in right now. I am Adrienne Thornton, and I am hosting today the ALF Town Hall. And it is a bittersweet day for us here because this is our last and final broadcast for Black Life Amplified. We have had a wonderful time over the last 2 years communicating with our community, touching our community, sharing with our community, and reaching out to our leaders to share with our community. So we are sad that it's time for us to go. We will be doing this in a different format and platform at sometime in 2022, but we are excited to be here today for this final show. I want to start by thanking our sponsors, Minnesota Community Cares and Minneapolis Foundation, of course, Northpoint Health and Wellness, and Children's Minnesota. There have been so many people supporting us throughout this last almost 2 years. It feels like just yesterday, but it's been almost 2 years now that we have been doing this show. So thank you to all of the organizations that have supported us, including ALF, Insight News, Gray Matter, North Point Health and Wellness, Minnesota Community Care, and of course, Children's Minnesota, where I hail from. Today, for our final show, we're going to wrap up the way we started. We started doing these broadcasts to bring information, education, and insight about COVID 19 to our community. We wanted to make sure that our Black and Brown and American Indian neighbors and friends and family and loved ones had the correct information and the updated information so that they could make decisions about going forward throughout this pandemic. So we're going to end the way we started. We're going to be wrapping up COVID, talking about where we are now, where do we go from here, what should we be doing. We're going to talk a little bit about vaccines, and then we're going to end on a happy note with how we can support each other through the mental strain of living through a pandemic. So I want to start by introducing our panelists for today. And you know them all. They've been here before. Again, I like I said, we're going to end the way we started with the people who helped us start this program. So, first is Dr. Zeke McKinney. He is the program director of Health Partners Occupational Health and Residency. Hey, Dr. Zeke, good to see you again. So happy to be able to end the show the way we started with you and I as partners in battling this pandemic with our community.
Thank you so much for having me.
And next we have Dr. Craig Gilliam, who is the Associate Medical Director of North Point Health and Wellness Center. Thanks, Dr. Gilliam, your support over this past 2 years. You know, we just cannot measure it. And we really appreciate you for coming back for our final show to kind of put the icing on the cake for our community.
Thanks for
And
having me.
yes, wonderful. And then Dr. Garrett Akinsanya. She is the executive director of the African American Children's Wellness Institute. Welcome back, Dr. Bravada. We call her Dr. Bravada. So wonderful to have you here for this last and final show. And I'm going to keep saying that throughout the show because I can't believe that it's coming to an end. At the same time, I am really excited for all that we have done for our community over the last 2 years. Now, with that said, we're going to just jump right in and get to the good stuff. So let's talk about COVID 19. And I'll start with you, Dr. Zeke. Looking at the numbers and the data, because I'm hearing it on the news, and of course, I am looking at the numbers myself, but I'm going to let you tell our community where are we now in terms of COVID 19 infections and hospitalizations and deaths, especially compared to where we were when we started this show almost 2 years ago?
Yeah, well, we're kind of in the middle. I mean, we have rates right now about as high as they were, or haven't been this high since December of 2020. And honestly, right now, Minnesota has some of the highest rates, maybe the highest rates in the whole country. Some people suppose that may be related to, cold weather and more people going indoors. But even despite vaccinations, we're still having very high rates of COVID. Our hospitals across the Twin Cities are full right now. I mean, I've heard horror stories of people getting triaged in the ER, in the ambulance bay, like they kick the ambulances out, and then getting admitted to the hospital and staying in the ambulance bay. There are people, I heard a case, this is a few months ago, somebody who, not in Minnesota, died, when they needed gallbladder surgery and couldn't get into the hospital because there was nowhere to take them. And I mean, that's something that never kills anybody now. I've had patients looking for doctors looking for cardiologists, heart doctors to take their patients who have had a heart attack and they don't have anywhere to send them. So, I mean, I guess if you don't believe in COVID, I would say otherwise don't get sick right now because there may be nowhere for you to go. So unfortunately, we're looking similar to where we were a year ago, and it's not great. And so moving into the holiday season, and maybe I'm jumping the gun on things we're going to talk about, but I would stay at home if I were you.
Okay, Dr. Zeke, some of us can't stay home, but I understand what you're saying. And I want to be clear with our friends and family. Children are being impacted by this. I work at Children's Minnesota, and we are busier than ever. We are full to the brim. And like the adult hospitals, we are struggling to get kids through our ED because our EDs are so busy. And they're also holding patients that need to be admitted because we don't have beds to admit them to. And it's not just our hospital. I've talked to colleagues all over the country, and all of the children's hospitals are experiencing the same thing. So if you think that children aren't impacted by this increase in numbers and the increase in cases and hospitalizations, that just isn't true. I mean, I looked at the data yesterday, and we showed some of the data early on last year when we started the shows. And for the most part, for all of the different graphs, for hospitalizations, for ICU admissions, for death, you saw a big spike in our older population. And then when you got to the kids, it was kind of low, almost, not non existent, but very low. And now it is the total opposite. When you look at the graphs now, when you're looking at our children up to about 30 years old, it has spiked exponentially, and the charts are basically flip-flop, where we're seeing more of the hospitalizations and ICU admissions in that group between, children to 30 years old. So it's definitely impacting our children, and I don't want anyone to think that it isn't. And Dr. Gilliam, I know that you're in the clinic day in and day out. Can you speak to what you're seeing in terms of numbers of patients? Are you seeing more patients that are having more respiratory issues or other issues? What are you seeing at the clinic day to day?
Definitely, we are seeing a lot more kind of viral respiratory illness in kids as well as adults. I say it often, an allergy is not an allergy and a cold is not a cold in the middle of a pandemic. Just this morning, we're doing monoclonal antibody treatments in our clinic. Just this morning, we did 5
Oh,
people. And we have a fairly high positivity rate at Northpoint. We kind of have hovered in the 17 or 18% positivity rate in the community that we service, and it's skewing a lot younger. So kids, your adults that weren't as high risk previously are coming in now. Those 20, 30, 40, 50-year olds who thought they were safe previously are now the ones that we're seeing having these infections. And then it's complicating their chronic conditions that they may have been dealing with previously. Those who had, high blood pressure or issues with the sugar, who may have delayed care before. So not only is their blood pressure and their diabetes out of control, but now they also have this new cough. They also, so we're evaluating all these things at once, while we kind of sit in the hotbed of infection right now for COVID.
wow. 17% positivity rate. That is really high and really concerning because if I understand it correctly, if not all, the majority of your patient population comes from the community of color. So that
Right.
means that in that
Yeah,
community, we're seeing a really high rate of positivity.
correct. We primarily service North Minneapolis, so 5541112 are our kind of largest zip code draws, and so that positivity rate reflects kind of the community itself. And then when you look at vaccination rates, the lowest zip codes in terms of vaccination rate in the state are 55411, 55412. And this area also skews younger, so it does not bode well for our immediate community that Northpoint serves, and then the larger state as well.
Wow, wow. That is incredible and disheartening. And so we'll talk more about the reasons why, but I want to go to Dr. Bravada now. And earlier in the year, we talked about mental health and the impact the pandemic has had on Black and Brown communities in terms of, the stress of the pandemic, the isolation. We looked earlier on at the suicide rates across the country, but also in Minnesota, looking at how that had changed because of the pandemic. And so, Dr. Bravado, what are you seeing now in terms of mental health diagnoses or issues with your patients? Are we seeing less suicide attempts, or is it about the same as it was this time last year? But what are you seeing in your clinic in terms of how this pandemic is impacting the mental health of our community?
Thank you, Adrienne, and it is good to be here. I am excited about, although this is the last show, I'm excited about being here to kind of wrap it up well. And what I've been seeing in my clinic is an increase in anxiety disorders. And some earlier increases were noted in depression and some increases in suicidal ideation, especially when school kids weren't able to go to school at all. Parents were feeling pretty trapped. People lost their jobs. So financial pressures were also ensuing at that same time. So we had a variety of factors contributing to situational factors contributing to our problem. And on top of that, people were getting COVID. And so now what is going on is that I've noticed in the larger culture, more dominant culture where white community members are, they are experiencing less trauma and less deaths. And in our community, when we do healing circles every Friday in various locations, we hear almost a virtual roll call every single week of someone who is dying. And those people who are dying used to be the elderly. But just like my brothers are saying, we're seeing younger people getting infected and really, really sick. People's relatives in town as well as out of town are dying. So we have a lot going on. And I'm really concerned about the behavioral health, because early we were talking about washing one's hands and social distancing. And a lot of people felt like, well, I don't need to social distance now. I don't need to wear a mask now because people got their shots. And what they don't understand is how the disease continues to be transmitted. They don't understand that you can be asymptomatic and your behaviors, coughing on somebody, say, oh, don't mind it, girl, I already got my shot. That's not all right. And so that's a big part of it. And then the larger part, I think, is really important. It was a pre-existing denial of our value as human beings. That predated COVID. We were already experiencing a pandemic of racism. And many of us have internalized that we are less valuable. Through generations and generations and generations, we've had this idea that unless you're white, you're not all right. And so when we were given the first opportunities to get our vaccinations, we kind of shied away, said, girl, I ain't going over there. Who knows what's going on? You might wake up a zombie or your arm might fall off. Or I'm going to see. I'm going to wait and see. And what we waited to see is numerous people in our inner and outer circles being impacted by that disease. So I definitely know that there's a lot of depression, there's a lot of anxiety, and it's not just in the adults, it's very present in the children. And the way it shows up with kids, it's not that they'll say, Mom, I'm in need of a therapist. They'll start acting out. They'll start
Mm-hmm.
sneaking out. They'll start talking back, doing things that they normally wouldn't do. They're showing that stress. And inherent in that depression, anxiety, and misbehavior is a fear. It's a fear. And that fear is, if you die, who will take care of me? Or if I go play, will I die?
Mm-hmm.
If I kiss my grandmother, will I kill her?
Mm-hmm.
That's what we really, really, really need to talk about, I hope, today.
Wonderful. Thank you for sharing. And Dr. Zeke, you had some follow up to what Dr. Bravada was saying that you wanted to share.
Yeah, Dr. Bravada and Dr. Gilliam mentioned a few points that I think are relevant to the first question you asked about, why are we where we are now, 2 years later after the start of this show. And I said it's a lot like last year. Well, I mean,
Mm-hmm.
some of the big differences we observed are, we saw these rates go up when kids went back to school this September, which was different than last year simply because a year ago, many schools were doing virtual or hybrid options. And now pretty much most schools are completely back in person. Going alongside of that, we only had the introduction of vaccines for 5 to 11-year-olds in the past like 1 to 2 weeks. And so we saw even like somewhere like Florida, going to your point, Adrienne, about, the flip of the rates for adults and kids. In Florida, kids cases outweighed adult cases in September. I mean, they were like 50,000 cases in kids. And I think it's because of these factors. Now, we also know schools aren't having mask mandates globally, and people were fighting to get our governor to do it, and he wouldn't. We aren't having vaccine mandates, not yet, even if it was out everywhere. And certainly schools aren't having testing mandates. So a lot of people are kind of living in this like don't ask, don't tell world. Well, if we don't know if people are getting sick, then I guess it is what it is. And that's sort of what's happening in the community too. I mean, we're also not having hardly any restrictions on what people are doing out there. Most places I go, people aren't wearing masks anywhere to the point
Right.
that Dr. Bravada mentioned, because we're like, oh, I got the shot, so I'm good. And it's like, well, no, we've had these new strains. The Delta variant is, like what, 6-7 times more infectious than, sort of our original recipe COVID. So all these factors layered together, people doing more and kind of not caring as much about being worried about this because, they're not dead yet. Kids in school being a good transmission point. And, we sort of just let up on the brakes that we pushed to sort of slow this down. And so all of this has resulted in we're kind of back where we used to be. And what I've said from the beginning is, look, you look at places like New Zealand, Australia, where they just, even China now, lock down everything. This thing could have been over. But, here in America, we take personal freedom very seriously. I want to do what I want to do when I want to do it. And so, this is the price we pay. That, unfortunately, this is going to continue to be spread and be something we're going to have to deal with for a while. And just to give people context, I mean, the last pandemic 100 or so years ago took about 3 or 4 years. So here we are.
Here we are.
We have as
Yeah.
much technology as we do now.
Yeah. And it's unfortunate. We all want to get back to living our lives, but we have to be mindful of the impact of that. I had a conversation with my daughter just this morning. We're both fans of Korean pop, and our very, very, very favorite Korean pop group is going to start a world tour in January. And I was like, oh, that's so exciting. We should live stream the one this month. And they're coming to Chicago, which is where we usually go to see them. And my daughter just assumed we were going to go to Chicago and see them. And I said, no, we will not. I said, first of all, I don't want to wear my mask for 2 hours and watch them perform. That's number one. But number two, they will not be doing any social distancing in that theater. There is no way in the world I'm going to drive all the way to Chicago to sit in a room full of people that I don't know. Some and most of them won't have on their mask. I already know that. I said, no, we can live stream it. I would love, and it's a rarity for this band to even come to America. So this is a big thing. It's like we may not see them perform in person for years to come because they just don't come to America that often. That's okay. We're going to miss them this time because I am not taking a chance on my life. I'm not risking my son's life. I am not risking my daughter's life to go to a concert. It's just not that serious for me, and it never ceases to amaze me. I see people, posting pictures of all their get togethers and all their fun. And, I can't even do a like or a heart button because I look at the picture and I'm like, I can't believe all of them are together in that small space and nobody has on a mask. This is what comes to my mind. And so I think that people are going to have to change their mindset, or it's going to continue to impact our community disproportionately. We talked about earlier in the year that I lost my adopted mommy to COVID, and she happened to be a Latino. And personally, I feel like her medical management was not adequate, but that's neither here nor there at this point. But it's impacted me. My son was hospitalized with COVID, and I've talked about him. He's a special needs person. Even with the vaccine, we have to be careful because his immune system, he had some issues with it. And so we have to be extra careful. And so for me, it is a life or death situation. I am not willing to risk my life or either of my children's lives for this. And my daughter is studying in London now, and she called me, the first few weeks, and she was like, Mom, they won't even let us into a nightclub unless we have documented proof that we had a negative COVID test within the last 2 days. And then you come to the United States and they're clubbing and they're partying and nobody has on a mask and everybody's all on top of each other. And it's the total opposite. And she loves being in London. She's like, I don't care if I have to wear my mask all the time. I don't care if they limit how many people, can be in a place. I'm okay with that. And not to be legal, but that Travis Scott concert, which was quite unfortunate and just sad beyond measure. But again, nobody had on a mask. It was too many people in there. And, it's going to be interesting to see what happens in the next few weeks, after that concert, because we've already had people die. And I always wonder, are there going to be deaths as a result of them not following the guidelines of masking and social distancing? So I'll get off my sandbox now. Let's move to a happier topic. Let's talk about vaccines, because that's one of the ways we can get out of this pandemic. I'm vaccinated. I actually got my booster last week. My son is vaccinated. He's going to get his booster real soon. And unfortunately, my daughter is in London, but she's in your trial, Dr. Zeke. So she's waiting. She said, well, I didn't call the office yet to see if I could get a booster. I'm just going to wait. And I said, okay, well, we'll talk to Dr. Zeke and let him tell us. But let's talk about the vaccine. So let's start with the efficacy, because we keep hearing people talking about, well, if the vaccine was effective, people wouldn't still get COVID. So Dr. Zeke, let's talk about that, because you and I know the answer to that, but tell our community about the efficacy of all the vaccines.
We're going to go back to basics.
Let's go.
Vaccines do three things, just so keep it all the way real. Vaccines can prevent disease, like prevent somebody from getting COVID. They can prevent somebody from getting severe disease, that's being hospitalized or dying. And then they can prevent the transmission of disease. No vaccine for the history of vaccines on Earth in the last 200 years has been 100% for all three of those. It never happens. But this COVID vaccine has been pretty good across those three dimensions. Certainly back thinking about, our original recipe strain of COVID, vaccine efficacy was up in the 70s, 80s, 90s%. Transmission was reduced by about 2/3. Prevention of disease was pretty good also. With the Delta variant, some of that has come down. Prevention of disease is not as great. We've seen a lot of breakthrough cases. Prevention of severe disease and hospitalization and death is still really, really good. And then prevention of transmission of disease is still also reduced, given the fact that we see the reduction. Now, the good news is, if people thought this data was hard to interpret, the CDC actually has put out data on their sort of COVID data tracker showing rates and deaths of COVID by vaccination status and by what vaccine you got, if you want to see it that way. And so if you look at it, they just put it really simple. They say, look, unvaccinated people, and this is from data in August, but you can look at it going forward. Back in August, unvaccinated people had a 6.1 times higher rate of testing positive for COVID and an 11.3 times higher risk of dying from COVID. So, there's some mythology out there that the vaccines are killing people. That's not true. In fact, there's more data than ever before showing the vaccines are insanely safe. Even some of the stuff we thought wasn't safe about them, even those rare things before, we're finding out that probably wasn't the vaccine as much. The second thing people are saying is, oh, well, people who are vaccinated are dying at much greater rates than those who are unvaccinated. Not true. Ask anybody in the hospitals. Look, if you can get some doctor to go tour you of the ICU and the floors at any hospital right now, that's a majority by far unvaccinated people. Now,
Hmm.
people say, well, wait a second, what about Colin Powell? He died of COVID and he was vaccinated. Yeah, Colin Powell also had cancer, a disease that will affect your immune system, and he was already going to be sick no matter what. And so, to Adriene's point, about her son, and I don't want to talk about it, but you brought him up, Adriene, having a condition that may impact his immune system. These are the people we got to watch out for. And we haven't even talked about the people who can't get the vaccine because their immune system can't generate a response. So, suffice it to say, the vaccines work. They still work great. And I cannot emphasize enough. I've been boosted. I got boosted the same day as our president. My kids, two of my kids who are old enough, just got their first dose yesterday. I mean, so if anyone's worried about like, well, gee, would you give your kids a vaccine? Yes, I did, and I would have forced them if they didn't want to. But talking to me as their dad, I think they believe in the importance of it.
That's true. And it's crazy because the excuses people give is, well, I don't trust the vaccine. I don't know what they put in it. And so I always want to say, well, are you eating food that you produced yourself? Because if you're not, the risk is the same. You don't know what's being put in that food. And not to be crass, but for our young people, you're out here living your life and having relations with people. Do you ask them where they've been or what they've done? There are so many other things in our life that are more risky than this vaccine. I just don't understand why people are still holding on to these beliefs. And Dr. Gilliam, I know that Northpoint Health and Wellness, you all are offering testing and vaccines to the community. Are you able to penetrate the wall of negativity and the wall of distrust to get more people vaccinated? Are you seeing that with the numbers increase, more people are starting to get vaccinated, or is it about the same?
Well, we definitely have, we saw a dip in vaccination rates a few weeks ago. Um, new people coming in for first and second doses, but we've been fairly consistent. Up until about today, we've given about 19,000 vaccinations here at Northpoint itself. And with the introduction of the boosters, we've seen our numbers skyrocket. So we're, have an increase in demand, and also for our 5 to 11-year-olds. And to echo Dr. Zeke, I have a 9-year-old who will be 10 in a week and a half, and she got her her first dose last week, because we have not seen my parents, her grandparents, since Christmas of 19.
Oh,
Um,
wow.
and so aside from video chats, because they live in DC, so I think, and I think some of what we're seeing in the state more broadly, and particularly in the community, MDH released data last week showing that 100% of Black people and Asian people 65 plus have been vaccinated. Um, and, so that lets me know that our elders, our seniors know, they get it, they understand. Earlier in the early days, it was like the people who were most impacted were our seniors, so our 65 plus, and the younger folk, those kind of 19 to 44, thought they were not as at risk. And that did bear out in some of what we were seeing, but now we're starting to see that skew younger, those who are at risk now. And so I think that's also why we still see a fair amount of disease and infection in this particular community here, because it is fairly young. um, you know and just into battling some of the kind of mistruths around the vaccine. It just takes conversation. I talk several people a day, not necessarily talk them into it, but we have a conversation around a vaccine, and they make a decision that I think benefits their health and the health of their family and those they love. Um, and so it's just a constant conversation. Many people tell me I wasn't going to get that thing until I talked to you about it. They want to talk to someone they trust. Um, and then I get asked all the time, did you get it? And I say, yes, I got it. My wife got it. My child just got hers. Made sure my parents got it. Made sure my in-laws got it. Um, and if you want it, we give it to you today. Um, And because we know the proof is in the pudding, it has helped to reduce our rates of hospitalization and death, because our communities were vulnerable prior to the pandemic, and the virus kind of capitalized on those vulnerabilities. And then, as Dr. Bravada mentioned, that then just exacerbates other things. And so we're fighting a battle on multiple fronts, and trying to combat vaccine hesitancy, because this is the disease really that is private. Because once you are diagnosed, you're not in the community. You are home in your room, and you're by yourself. So people don't see people suffer. And it's not in the news as much as it was before. So it's not in your face. So people are like, oh, nobody has COVID anymore, despite all the numbers that we know, because we pay attention to those numbers. But if you're not looking every day for numbers, you don't know, particularly if it's not you or your family that's been impacted. So really kind of keeping things in people's face, and not being shy about, asking, so did you get vaccinated, or would you like to be vaccinated? And so I think that's what we're doing here to try to combat any hesitancy. But I think some of those numbers I brought up actually allays some of those suspicions that the community was hesitant, because it shows that at least our elders were not. They got it, they understood, and that those rumors of hesitancy were not just that. It was like a lot of our people were wait and see, and not I'll never get it. So
Right. Yeah, yeah, the fear and the distrust and anxiety is real. And I get it. And I'll be honest, I always had, questions, which is why I did my own research. And then I read the book Medical Apartheid, and it almost paralyzed me. And I started questioning everything. And as a result, I had a little extra anxiety for myself, not necessarily related to the vaccine, but related to the pandemic itself. How did it start? Who started? Where did it come from? And so, Dr. Bravada, you mentioned that you're seeing more people who are experiencing anxiety now. Are you seeing a lot of patients who are experiencing anxiety related to the vaccine itself and the decision to get it or not get it, or the fear of the vaccine and what it can do to them? Are you seeing that in your patients?
Yes, I am, Andrea. I'm Adrienne, and it's not just the fear of the vaccine. It's fear of making a mistake that's going to have a long lasting impact on their lives. And they think that since the disease hasn't been out that long and the vaccine hasn't been out that long, well, let's look for 2 or 3 years down the road and see if people still have their arms, see if they still have their ability to think, and making sure something bad doesn't happen. So that problem is one that persists. Another issue that I wanted to talk about just a moment is that we look at our psychological science, and we like to look at the behavioral health component, because one of the biggest problems with this and other diseases that are easily contracted is the human behavior. And that's what psychologists study, of course, where our expertise and how to monitor and influence behavior. So one of the psychological science studies talks about the impact of modeling by trusted and valued people. So when someone would hear, let's say their doctor, like we heard a moment ago by one of my brothers, their doctor say, yeah, I took it, I took the shot, my kids took it, my family took it, then they will breathe a sigh of relief, because that's someone they trust and they believe that that person knows the science. So that impacts behavior. So a lot of times people don't have that opportunity to hear from their doctors. So shows like this gives people a chance to hear somebody who looks like them saying this is the truth and I'm not lying. So the second thing is that we see people giving more credence to myths than facts. And that is because we are an oral based community. And part of our way of transmitting information is by talking. And so one of the problems is most of the time when you're here talking, you're in the same space, you're in the same room. So let's just think of some of the people that hear, where they hear that talking. They may hear it from their friends. They may hear it from their pastors. They may hear it from their supervisors at work. So when people are in these positions of authority, they often use their power to influence, let's say, their congregations at church. I had one particular client who had gone to his spiritual leader and during the service, and he told everybody, don't take that shot. You better not take it. And then maybe a week, 2 or 3 weeks went by. I was trying to explain to the client, you should look into it yourself or read about it yourself. And next thing I know, he wanted to go to, I think the Whispers came to town, and he had received a free ticket to hear Stephanie Mills and the Whispers. And he hadn't heard them in years, but before you could get to the concert, you had to get your vaccination and have proof that you've had it. So that's the only thing that led my client to go ahead and get the shot, is because he felt like he was given an opportunity that he may never ever have again. And he saw that I've taken it, other people have taken it, hasn't killed us. So that prompted that individual in particular to go ahead and get the shot. The second thing I wanted to talk about is what one of our several studies talk about how people choose. And one of them describes the fact that you can't persuade somebody to do something by giving them all the facts. Trust me, very few people do that. What they need to do is have critical thinking. And we have to kind of elicit that by saying things such as, well, okay, we see what you think about taking the vaccine. You don't want to take it. But let's think about the consequences if you don't. You're a single parent. Your family isn't here. Your cousin uses drugs. And you can't put them with them. You only got one more brother and he's elderly. He can't take care of your kids. What will happen to you? And what happened to your children if you contracted the disease and died? What are your plans for that? And that, according to the research, will help people when they evaluate or take a survey of what they need to do and what the impact of not taking the vaccine will be for them. And finally, I just want to say that the anxiety that people are feeling is often anticipatory. That is, if I go out and I go to the mall or I go to the grocery store, I could catch it. But they're afraid that if I get the vaccine, something bad hasn't happened to other people, but it would be something bad that would happen to me. So I see a lot of anticipatory anxiety, and most of it's around race in medicine or race in healing. And that's another whole part of the conversation I think we can have.
Wow. Yeah. You mentioned anticipatory anxiety, and it's real. Even for myself, I've noticed I live in Dakota County, and our numbers tend to be higher because our vaccination rate is so low. And if I have to go, for instance, to Target or to Aldi or anywhere out here by my house, I have to prepare for it mentally because I get a little anxious because I'm like, oh my gosh, is this the time of day when there's going to be more people there? And I use it as an opportunity to get my son out of the house. And then I'm like, well, how do I navigate him around all the people who aren't wearing masks, who may not be vaccinated, who may have COVID? And so it is some anticipatory anxiety related to just living every day. I just can't imagine the amount that other people are having, trying to live and trying to deal with getting the vaccine and all the other things. It is just incredible. And you mentioned something else about the impact. We talked about it a few weeks ago. One of the things that I think people don't realize is orphanhood is higher for Black and Brown communities as a result of the pandemic. There was a study that was published, and it showed that more primary caregivers of Black and Brown children were dying than in any other community. So now we have more orphans in our community than we've ever had before. And so, I always think about that mother and father of 7 who were going on vacation to Florida with their kids, and they didn't want the vaccine but decided they would get it, but they were going to wait until they came back from vacation, and they never made it to vacation. They both died, and their 7 children are now all orphans. And it just breaks my heart, because I always want people to understand there is no judgment for you not getting the vaccine. It's your choice. But I have to do what's right for me and my family as well. And so, for instance, my very best friend in the whole wide world, who is also a nurse, is not vaccinated, and she and her family got COVID. And she said to me, if I die from COVID, you have to come to my funeral. And I said, no, I don't. I will not be there. If you die, I am so sorry for you and your children, but I will not be attending your funeral because you chose not to get the vaccine. You made your choice, and I'm making mine. I love you. We're still friends. We'll have to FaceTime until this is all over. But no, I don't owe you anything. That's something that you chose to do. And so people, again, like Dr. Zeke was saying, we're so into our own egocentricity. It's about me, me, me. America is all about me. And we just don't think about others. And so until we get to the point where we're thinking about other people, I think it's going to be the same. Dr. Zeke, you mentioned something about the impact of past experience in our elders, the reason why 100% of them are vaccinated. Can you speak to that a little bit?
Yeah, and I was just saying this in our internal chat just to stimulate discussion amongst us. But mostly, I was making the point that, to Dr. Gilliam's point, that now 100% of those 65 and older, both in the Black and other communities of color, probably white as well, being vaccinated. Does some of that have to do with the fact that they had seen diseases in the past that essentially had really horrible long-term outcomes if we didn't get treated or certainly get vaccinated for it? And in the past, such vaccinations didn't exist. So like a good example is polio. People could get polio and they would have problems potentially with their legs or walking for the rest of their life. That was, an issue for President Roosevelt. A lot of people didn't know originally that he, had trouble walking, but eventually that came out and it was because of polio. And then we had a vaccine for polio and that went away. People don't know that measles can cause a very severe form of a brain illness that can kill you. Again, we don't see it because most people are vaccinated against measles. And so to some degree, we're privileged to not have seen these horrible consequences of infectious disease, to the extent that we're like, now why would we get vaccinated? That's not doing anything. That's not real. It's because you haven't seen people die from that. 100 years ago, the number one killer of people across the world was infectious disease. Most kids didn't live above age 5. Most adults didn't live above age 40 or 50. But now we have such great healthcare, great technology that, we've been a little bit spoiled not to know this. So that's one thing about, I think, our elders having seen some of that stuff in the past and maybe taking it more seriously. Of course, the second point being early on, especially before vaccines, they were the most at risk. And so maybe, they took that more seriously, knowing that, it's of concern for them. And Dr. Bravata can probably speak to this point better than me, but we know that young people feel invincible. When I was 20, I felt like I was going to live forever and never die and nothing could harm me. And now I'm about to turn 40 and I'm like, I better, take a little better care of myself. So I'm around in another 20 years when my kids are, in college or whatever. But, so there's different effects there. But Dr. Bravata's right. Numbers aren't going to convince people enough. A lot of it's having these face-to-face conversations. First of all, being open to listening what people's concerns are, and then doing your best to address it. I mean, Adriene, you said people don't trust the vaccine companies. I don't either. They're making tons of money on this stuff. People say, I don't trust the government. Me neither. I don't work for the government.
Right.
People say, well, I don't trust doctors. I don't either. I'm just asking you to trust me, man. Like, it is what it is. Look, we know the government, we know healthcare, we know companies out there have all harmed communities of color and certainly not had communities of color's best interest at heart. But at the end of the day, we know people right now are dying from COVID. And we know black people are dying at greater rates. And white people are falling all over themselves to get these vaccines for themselves and their kids. So, I mean, to some degree, I was joking, and Dr. Barada is going to maybe get mad if I say this. Like, I might as well start telling people, you know what, this vaccine isn't for you. This is for other people. And then people will be, like, fighting me to get it. But, of course, it's unethical for me to say that because that's not true. But, you know,
Right.
it's like some of that psychology is the hard part. And, I'm
Yeah.
working on it myself.
I think we're all working on it. So, you know what? I'm over talking about this. This is making me sad, and I want to go back to my happy place. So, we're going to shift gears now, and I'm going to bring in Mr. James Burrows, who is the Chief Equity and Inclusion Officer at Children's Minnesota and one of my mentors. Welcome, Mr. Burrows. And we can't hear you. Producers, is there a way for us to unmute James?
Try now.
Yep, we can hear you now. Good. There we go.
User error, wrong button. so, so thank you for having me. Good to see everyone here. I'm glad I'm responsible for all happiness coming after the COVID conversation. Real quick to Dr. Zeke's point, it's about that trusted messenger and trusted relationship. When he's at the barbershop, my barbershop with Tito, chopping it up, when I come in and the brothers on the street who I know don't have a medical degree, I know just live here, they're like, bro, you got your vaccine? Let's talk about it. I was like, that's what I'm talking about. Somebody can meet you where you are, have a conversation. If they don't know the answer to the question, they may bring in Dr. Zeke. They may bring in someone else. So that's what we need to keep doing. So I'm excited about doing that. I want to thank all you for being on the show as well. Just real quick, this show started more than a year and a half ago with just an idea from Insight News and my girl Batala McFarland, and said, hey, we need to do something about our community around COVID-19 and get the word out. And it turned into this. And AALF became a partner as well. And Brittany Wright, who's healing right now, became a host, and so did Adrienne. So thank you all for bringing this together. This is what we need in our community, folks. A lot of times we say, trusted messenger, but we don't give them a voice to get the word out there. We don't get the presence or the platform. They don't always put us on CCO or KSTP or other stations. We got to do it ourselves. So thank you all for being here. And Adrienne, whatever happiness I can continue to bring in between now and going back to the Children's Minnesota Town Hall to talk strategic plan, let me know.
All right. Well, why don't we talk about, while we have you, James, let's talk about what we did with this show. We reached so many people. We had some wonderful guests. We were able to take COVID-19 and talk about it in relation to every aspect of the community impact, whether it was mental health, maternal health, child health. And so, what was some of the exciting shows for you, or some of the guests that were memorable for you, that puts you in your happy place, perhaps?
So good question. It don't put me in a happy place, but it puts me in a place where I realize that we need to have different voices and opinion. So we had a public safety show right when the trial was happening, and the consensus of folks in production, I was just one voice, like, let's bring on public safety. Let's bring on the state and talk about Operation Safe, whatever they called it. And let's talk about how they're going to put the barriers up and the fences. And I'm like, I ain't trying to hear all that, because having been in this town when they've shot many black men before, you're going to put fences up when we want to voice our opinions after a verdict, and you're scared of us, and we want to talk about that. But everybody else outvoted me. I said, okay, fine, let's do it, because it is a COVID public health component to it. It is about having voices heard and having our voices heard in a way that we need to make sure that we're doing things safely. We're protesting safely with masks, social distance as we can, to be mindful of that, and allowed us to push and ask questions about that system as well. And what I realize is, in this show that's been exciting for me, Adrienne, is we can all have different voices and disagree and still come together and have a discussion. And in our community, especially our Black community, that's so important. We don't do that enough. We sometimes pick people in silos, or I'm not talking to that person, I'm not meeting with her. What, Adrienne's the host of the show? I ain't gonna be on that show. It doesn't make a difference. Let's get our voices heard. But one of the fun shows that I remember too was a comedy show. We put comedians on here to talk about what we need as far as our mental health awareness, to laugh. We've been locked away for almost 2 years now. We need to laugh. We need to enjoy ourselves. We need to have a good time. So what we were able to do, what I'm so proud of, is take COVID-19 and not just focus on the medical aspects of it, but also the life aspects of it in the Black community, about our culture. We have folks on here about business, how Black businesses have been affected, and how we need to double down and reinvest in them. So I love it because for the first time in a long time that I've seen, it put together public health with who we are as a culture and also who we are as need to be as a people going forward. So I was excited about that, and we had some young people voices on here at times as well. So I was excited, and I'm excited, to be quite honest, of figuring out how we make it continue. It's gonna press pause for a little bit. We may have talked about that, Adrienne, but we're looking to reconfigure the partners and that kind of thing. But I commit to you that at Children's Minnesota, we got so much planned, especially for our community. And the voice of the community needs to be the folks on here in these squares, and they are the trusted messengers. Children's doesn't bring the brand to the Black community. These folks do, and people do, and you do, Adrienne, and I do, and that's what we want to continue to do. So I was excited about those kind of shows, and like I said, even the one I didn't want to do in public safety and about fences and guns and barriers and all that, it still turned out well.
Well, thank you. And, I have to say, when James first brought this ideal to me, I was like, no, I can't do that show. That's not what I do. I don't know anything about talking to the community and being on a show. And we figured it out. We made it work. And so that's been really exciting for me because, I would love it if I could just walk around Minneapolis and St. Paul and all the other cities and just talk to everybody, but I can't. So this gives me and my partners on the panel the opportunity to reach as many people as we can. Everybody's using digital and phone videos as a way to live now, and so this helped us move into this century with getting our message out there. So that's been wonderful.
Adrienne, one more point before I got to take off. The other thing that
Hmm.
also was great is when you and Dr. Zeke came to my family meeting on a Saturday, and I invited you to a meeting I just had planned on Zoom to say, hey, here's a Black nurse, a Black doctor, and talk to my family about the vaccine. One of our elders who started the meeting, she had been a nurse before, and she was in her 80s, and she said, I'm not getting the vaccine. And the reason why was, her shot, she didn't know where they were going to place the shot. She said, they're doing it all wrong. And I was like, wow, just talking to Adrienne and talking to, Zeke, that made it be different in a different place. So thank you for that. And those are the things that can come out of this. I got to go now. They're knocking on the door, but thank you for being here, everyone. And I'll talk to you all. See you later.
Bye, James. Thanks for
Bye-bye.
coming. So we're going to start to wrap up now. So I want to leave the show on a higher note. I always want to leave people with more than they came for. So I want each of my panelists to give, your words of hope for our community in anything that you want to say to the community in terms of the pandemic and going forward. If there are things we need to do or things we need to consider, but let's end on a note of hope and peace and love and light. I want it to be, when people think of Black Life Amplified, it wasn't, oh, all they did was tell us to take the vaccine. I want it to be that they gave us what we needed to make decisions, but also give us hope. So I'll start with you, Dr. Gilliam.
Well, I I was thinking about actually the blues and spirituals came to mind immediately. Because when we think back to the kind of enslavement period in this country, and then that immediate post enslavement period, and we enter into the kind of Jim Crow South. Just because there was suffering and sorrow, there was also joy. There was always an undercurrent of hope. And that was found whether it was in spiritual spiritualness in the spirituals, or for those who were less inclined in the blues. So on Friday night or Saturday night, and then Sunday morning for the others. And then we move time a bit in the time of the Depression. What do we get from that? The Harlem Renaissance. Again, beauty in Black culture and music and art. Move time a bit forward, civil rights movement, 50s or 40s, 50s, 60s. We get kind of soul music. And then and now that current gets us to where we are now. And so there's always been hope through suffering in our community, in our people. And so we don't lose that. We talk a lot about trauma and how it's transgenerational and how generations back we were traumatized, so that lives in us now. But what we don't often emphasize is that the goodness of those generations lives in us as well. So flipping that coin on its head and realizing that even though the suffering that we have experienced has put us in a place where we might be more vulnerable, it's also given us a strength that we don't always realize and know how to tap into, which is why we need people like Dr. Bravada and her staff to help us to dismantle all those structures, all those walls that we've built up around ourselves, or that have been built up around us, so that we can't necessarily see how beautiful, how strong, how good it is to actually be vulnerable, and not see that as a weak point, to make oneself vulnerable by choice and not be vulnerable because of something else that has happened to you. So I think the hope I find in the middle of all this is that we still are doing, we still are being, we still love each other, we still show up for each other, and we will continue to do that because that is what we have always done, and that will not change, at least not while I draw breath and those at sea that I encounter, and that I experience. That's where I draw hope from, just from my interactions with people like you guys and that I interact with daily.
Wonderful. Thank you, Dr. Gilliam. And Dr. Bravado, what words of hope or wisdom or pearls of wisdom do you have for our community?
I'm just going to piggyback on my brother by talking about the fact that we are resilient, and that when we recognize our value, we have to recognize that the God who created us to be well. And we can claim our wellness. We have a right to be well. Our community has a right to be well. Our children have a right to be well. And we should do it by any means necessary. And sometimes that means going through our own fears, walking through it and doing what's right and best for ourselves and our communities. And I wanted to just say that I'm sad that this program is closing, but we're still holding it down with Insight, with every Friday from 1 to 2, I'm sitting with Al McFarland doing the Healing Circle show. And we're talking about COVID and we're talking about this. So that's just because one door closes doesn't mean another window or door doesn't open. So we need to come together and continue that. And I guess the last thing I want to say is that my new motto is Our Black Lives Matter. Save yours. Get a vaccine today.
Wow, powerful. Thank you, Dr. Bravada. Our Black Lives Matter. I love that. I love that. And then last but certainly not least, my partner in crime, my COVID-19 buddy. I don't know what I'm going to do not meeting with you and doing this anymore, Dr. Zeke. We need to find something else to do. But what do you want to... I know. What do you have for our community? Well, I know you have some words of hope because you always have something to say. So come with it. Come on, let us know.
I do. Well, first of all, y'all got to know I'm an optimist at heart, even though I sound a little bit like Dr. Doom when I talk about the COVID, but that's just because I'm very draconian about public health. Now, first of all, Sister Adrienne, you might have undersold yourself. Look, I'll put you on any show talking about anything, and that was a silver lining that came out of this. You got to find out what a great screen presence you have. No, but
Thank you.
seriously, I do have to echo what Dr. Gilliam said, what Dr. Bravada said. I mean, we got to see Black people be resilient as ever through this, and thank goodness we've gotten to recognize that. Hopefully, some of the stigma about mental health has been reduced because everybody's going a little bit crazy right now with everything that's changed in our world. And we know that stigma has been worse for Black people, just like it's been worse in a lot of communities, whether it's, for police officers and firefighters and for doctors to some degree, which by the way the laws are changing around that right now with medical licensing too. So that's been good that we've all had to look inside and say, gee, here's what happens when something so bad so globally affects everybody. It's okay for us to take a breath and try to help ourselves and really focus on being able to persist through this. So good. Unfortunately, we had George Floyd's murder following right on the heels of the beginning of this pandemic, but silver linings there too. And I wish it didn't take George Floyd to die to do it. But people who weren't Black, suddenly started caring a little bit about systemic racism and gave more Black voices, such as the people on this call, but even greater, to speak about that in the world and to have recognition about how important of an issue this has been. I mean, look, I always was joking that even though we had social, unrest here and protests here and all around the U.S., there's protests in like Belgium and Australia, all over the world about George Floyd's murder here in Minneapolis. So, we got attention on the fact that the plight of Black people in America following American slavery for the past 400 years has been a very serious thing, even though it's like, oh, yeah, you had a Black president, so racism's over and, all that kind of stuff. That's nonsense. And we're still dealing with it to this day. But there is hope for things to get better. I was able to publish a paper on law enforcement violence not too long ago, which I don't know that 2 years ago I would have been able to publish. So these dual pandemics, and by the way, together, seeing how much COVID has affected Black and brown people has been a huge thing. Again, to also look at how all the social determinants of health have played a role in affecting us, and COVID has just been one more stacked on top of that. So we are the worst affected, not only from the side of chronic diseases, but also from the side of Black people as some of the most essential workers, the people who weren't going to have the opportunities to work from home, and we're going to have to be out there, making it happen on the streets. I've had, thankfully, some success in a lot of community partnerships, such as with yourself, such as with Tito Wilson of Wilson's Image, as James talked about. I think in some ways, all of the stuff I'm talking about brought more of the Black community together. I think it re-strengthened our Black doctors group. I know Black Nurses Rock has really done a lot of great work because of this. Again, I wish all these bad things didn't have to happen, but in a way, it energized us to be ready and to be, sort of weaponized to like get out there and make it happen. Now we got a vaccine clinic set up at Tito's Barbershop, sort of reinventing that community-based care, which again, I mean, this isn't the first time stuff like that's happened, but we had a need for it. And, like with Dr. Gilliam, once booster shots became available, it got even more prevalent. And so all of these things are things we could have done without the pandemic, and we could have done without George Floyd's murder. But those were inciting factors that led us to, get together and catalyze and do it. And I think that's a good thing. The trick is making sure we carry forward with that. Now, even more broadly than Black community, we've seen things. And by the way, now I'm speaking of stuff near and dear to my heart as a work doctor. Hey, by the way, people don't have to sit at their desk 8 to 5 every day like robots. There might be merit to having people work from home. There's actually really good impacts on human health and mental health and wellness. Like, oh, by the way, it's nice to have the flexibility to get your kids off to school in the morning and be able to pick them up from school in the afternoon. Oh, by the way, you don't have to pay for those buildings. You don't have to pay for parking. You don't have to make cars on the road. So the environmental health impacts were pretty dramatic. We got to see last year, flu hospitalizations went basically to approximately zero because nobody was around each other. And some of the respiratory illness Dr. Gilliam's talking about, while he's right, an allergy and an allergy during a pandemic is neither as a cold. But at the same time, we are also seeing much higher increased rates of respiratory illness amongst kids and adults because everybody's back at school, back at work, and back at everywhere. And for all the jobs who are out there telling people, oh yeah, we should get you back at work right now. No, you shouldn't. If it's not necessary, don't do that. We've proven the technology works. People are happier and they're doing their job probably just as well as they ever did. And I bet if you get them back to work, they'll be mad about it. So at the end of the day, I think there are lessons that we've learned, sort of unintended positive consequences of this pandemic, unintended positive consequences of George Floyd's murder. But, I think we have to carry these forward. And once we get past all this, be done with it. And the good news, the really good news is we showed that if you put enough money behind vaccine development and enough people like working on it, you can get it done fast. The community still doesn't believe it, but the science is there and it works and it's good. I mean, this was probably the most marvelous advancement in medical technology in probably the past like several decades. So I think people should really take a lot of pride in that too, knowing that we did it. And some of the people who helped develop that vaccine, the vaccines, were Black too. All right, that's it. I've said too much. I got me going.
We didn't expect nothing less from you, Dr. Zeke. Well, you all have said a mouthful, so I don't think there's anything much I need to say. I am just pleased as punch with the resilience that came out of our community, the togetherness, the joining together of our community. We haven't seen that in a long, long time. And so those are the two things that came out of the pandemic that I look forward to continuing to see. So I'm going to close us out now for our final show for Black Life Amplified. And I just want to say to my panelists again, thank you so much for being on this final show and helping us throughout the last year and a half, almost 2 years. I want to shout out our host, Brittany Wright. I am just standing in for her. I am not a replacement, and she is unfortunately unable to join us today for this final show. But Brittany, we are sending you and your family love and light. We miss you, but your presence is still here with us. We are not here without you. And I just want to give a last thank you to our sponsors, Northpoint Health and Wellness, Minnesota Community Cares, Children's Minnesota, and the Minneapolis Foundation, and to our partner organizations. Without them, we could not have brought you this show. ALF Insight News, Gray Matter, North Point Health and Wellness, Minnesota Community Cares, and Children's Minnesota. I hope that if you haven't seen all of our shows, you'll take some time and just go back and review them and see them. We gave some really, really good information on our former shows. You can find them on the ALF YouTube channel. And if you have questions, if you're on the Facebook channel where you can also find them, post your questions and someone will reach back out to you. And just because the show is ending doesn't mean that we're not here for you. We are still here for you. You can reach us through the ALF Facebook page or the YouTube channel. If you leave a comment, someone will get back to you. If you need to talk to one of the many panelists that we spoke to throughout the year, feel free to leave a comment and we'll try and get someone to reach back out to you. But thank you all for tuning in and joining us and just bringing your resilience and your passion and your insight and your love for our community to these shows. We hope to see you again in 2022 and have a good day.